and what a crowd. So clearly what we're doing here today means a lot to our community. Not just the people that work here that are representing Regional and Moses Taylor and GCMC, but the people that all of you take care of. So I'm thrilled to see this room and this activity here because it's important, and we must come to a solution. So my name is Bridget Kosierowski. I'm one of the state reps here with my colleagues over here to the right. I am a nurse. I've been a nurse for 27 years, 29 years actually, 29 years. I worked here in Scranton. I worked at CMC Hospital. I worked at Mercy Hospital in the recovery room, and I worked at the Northeast Surgery Center up in Dixon City before I ran for office. So this has a unique meaning to me. This meeting, this problem, and how we come to the solution, because I feel very compassionate about who we take care of, how we do that in our workforce. It's incredibly important that this hospital campus stays open. That is the bottom line, and that is the solution we must come to tonight. And we're going to talk about that. We're going to talk about how we got here. We're going to talk about how we move forward, a pathway forward, and solutions. And you know, sitting here to my right, I want you to know tonight's a town hall, but we all have been very fiercely advocating to come to a solution for a long time. You know, this came to our attention over 2 years ago, and we've been working with stakeholders and the governor's office and amongst ourselves and you know, private people here in our community that want to help everybody from the foundations to people that work there to just, you know, community members that know how important healthcare is to our community. I mean, we can't have a thriving Scranton, Pennsylvania without healthcare. We have wonderful education here, we have homes and resources here, but if we do not have access to healthcare, our city doesn't exist. And people won't want to come here and live here and retire here. So this problem is essential for us to come up with a solution. And I'm standing here as the face of this meeting here tonight and seeing this meeting and kind of, you know, having this organized, you know, with questions and answers, but I want you to know how important the people to my right are. When I say we, this has been a group effort every single day, and I'm hoping they're all shaking their heads yes, because every single day, essentially for the last 6 months, we have spoken about this. So it is our top priority, and we have the support of the governor's office, the Department of Health, the Attorney General's office. They're all hands on deck that this has to be solved, and the solution must be to keep these doors open. The service lines that we provide here, essentially, you know, at Moses Taylor, we have one of the best mom and baby hospitals in the Commonwealth. We have an unbelievable NICU, and anybody here in this room that works labor delivery or works with those moms and babies, we are really, really proud of what we do here, and you should be proud of who you take care of and the patients that you send out into the world. So that service line, the emergency room, cardiac, intensive care unit, our patients are, you know, I grew up here in Scranton. My father is a retired orthopedic surgeon here in Scranton. This has been in my family our entire lives. And we had 3 really good community hospitals here in Scranton. We had CMC, we had Moses Taylor, and we had Mercy. And we, the community, had a place to go when we needed health care. And you know, when you got there, you were in good hands. And we have to bring that back. It is essential that we bring that kind of care and that kind of relief back to our community. So with that being said, I want to thank everybody for being here because we're all on the same page. And I am really grateful for the people that I get to work with to my right. First and foremost, our Senator Marty Flynn. Thank you for being here tonight, Marty. My fellow representatives that are here tonight with me, Kyle Mullins, Representative Kyle Mullins. Kyle represented the city of Scranton before we redistrict, but the people from up the valley come down to Scranton for health care as well, so it's important for us to all be on the same page with this. Representative Kyle Donahue. Representative Jimmy Haddock is here tonight as well. Emma, are you next over there, Emma? Emma is a nurse, a registered nurse at the Regional Hospital ICU. We have Joanna Rosenhein from FAN, a consumer engagement manager. Congressman-elect Rob Bresnahan. You gotta jump right in. You're here. You didn't get sworn in yet. You're right in. I love it. Right at the table.
Ready to get to work.
And Mayor, we have Mayor from Wilkes-Barre, Mayor George Brown. I want to introduce Emma first. Some of you may know in the background of what has happened and how we got here. You know, CHS bought these hospital systems 11 years ago. And, you know, we can talk about CHS, we can talk about that, but, you know, about 6 months ago, we invited CHS, when I say we, my colleagues that work in Harrisburg with me, we invited them up to Harrisburg. And we wanted to kind of help them have a clean exit. Clearly they didn't want to be here anymore. Clearly they weren't investing in us anymore. So we kind of wanted to get them a pathway out of here and offer them a clean exit. At that time, we were informed that they had a letter of intent and a non-disclosure with Woodbridge Healthcare. So all of us got behind Woodbridge Healthcare because we wanted to make sure that we kept this place open and a reasonable delivery of care for this hospital. Unfortunately, because of financial barriers, Woodbridge Healthcare did not get to the finish line. So now we're back at square one, trying to get a health system to come on in and deliver health care for us that we can work with. So Emma, I'm going to have you talk about you know, Woodbridge, the Woodbridge sale, how it looked promising and why you think what happened with the fall through and why.
Thank you. Hi, I'm Emma Mangel. I'm an ICU nurse at Regional Hospital of Scranton and am a very proud member of SEIU Healthcare Pennsylvania, serving as the local chapter president. I think it's most important that we discuss the recent events that have happened that led us where we are today. Our local elected officials, that some of them were able to meet today, worked very hard contacting and having discussions with hospital corporations about purchasing the hospitals owned by CHS. Our elected officials did find a buyer to purchase the hospitals. A new organization called Woodbridge Healthcare came in with a sustainable plan that would keep the doors of these hospitals open. They are a nonprofit organization. Our hospitals would have been the first hospital purchased by this company. The sale sounded very promising and everyone was optimistic that we would have a good outcome. The sale of the hospitals were slated to finalize on October 31st, 2024. Unfortunately, the sale of Woodbridge was postponed for a period of time, but we remained hopeful that the sale would still go through. Ultimately, the sale could not be finalized. Woodbridge was not able to secure the funds necessary to purchase the hospitals. We know that this is no fault of CHS. The properties were being sold at a very low price. Given the recent turn of events with the sale falling through, we have found ourselves in a very vulnerable and uncertain time. But we do know two things for sure. We must save our hospitals, and the new owner must recognize our hardworking unions.
I just want to clarify, when Woodbridge Healthcare came to CHS, the legislature, we did not go out searching for Woodbridge. We had engaged with other health systems before we found out from CHS executives in Tennessee when they came out to Harrisburg. They were the ones that told us that they had already engaged in a non-disclosure with Woodbridge, which kept us out of the loop. We were not able to discuss anything with any other hospital systems. We kept some systems in the loop about what was happening, but we were not really able to engage with them to, we felt, be better deliverers of care. So it kind of put us in a tough spot for the last 7 months because we knew that things were moving forward, but not at a pace that we wanted to see, and we were optimistic and hopeful, but unfortunately, we're here now tonight because we know that sale did not go through. But thank you, Emma. Thanks for the background on Woodbridge. I want to introduce now Joanna. Joanna, you could either come up here or you could stay back there, whatever is more comfortable for you to speak. Joanna's from FAN and a consumer engagement manager. As a nurse, when I got to Harrisburg, everything is an acronym, so BKAs and all kinds of letters and all the acronyms. You have to explain who you are, where you come from, because I remember meeting a group that was like bilateral kind advocates, and BKA to me was bilateral knee amputation because I'm an orthopedic nurse. So I needed a whole year of figuring out who introduces who. So come on up here and you can kind of tell everybody who you represent and what you're going to do for us tonight. Thank you.
Hi everyone, so I'm Joanna Rosenhein from the Pennsylvania Health Access Network. I want to start today by thanking SEIU and PASNAP for having us here today. We're an advocate for patients, and we always center patient needs in these conversations, so we're really happy to be here. The Pennsylvania Health Access Network, or PHAN, is Pennsylvania's only statewide patient-driven organization working to expand and protect access to high-quality, equitable, and affordable health care for all. We spend a lot of time listening to patients across Pennsylvania, including in northeastern PA, and PHAN operates a statewide enrollment assistance program where we help people in enrolling in health insurance and resolving any problems that they have using their coverage or accessing care. Sadly, we're not surprised that we are talking about the closure of Regional. This fits within the broader statewide trend that over the past decade that PHAN has been tracking. Previous mergers or acquisitions, like what Regional went through, are excellent predictors of a full or partial closures. With 1 in 3 transactions leading to a closure, and 90% of closures being preceded by a merger or acquisition. We have tracked consolidations and closures because when a hospital closes, people lose easy access to care, and often the doctors that they love. They end up traveling more and taking time off from school or work. They delay care, have to wait longer to get care, and often simply give up and don't get the care that they need. So I'm going to talk a little bit about some of the research that we have on the slides here, but closures are often complicated by the fact that other local providers may be out of network with a patient's health plan when the closed provider was previously in network. So what we see here, SEIU has done a lot of research, so we're going to talk about some of the specifics of this transaction. Regional sees a lot of patients. We know from public data that they see around 381,000 patient, or they have around 381,000 patient encounters a year. Geisinger CMC will not immediately be able to absorb all of that care, and it can take years to expand capacity. That doesn't mean that patients won't show up at the remaining hospitals for Regional to close. These patients will have to wait longer, and increased patient volumes can put strain on staff and providers that are already stretched thin. It's also likely that patients will have to travel to get care. Wilkes-Barre has additional capacity, but many of the patients we serve cannot travel or do not have the means to travel that far. Let's face it, when weather and traffic cause delays, this added traffic isn't a small concern for us. It can be much longer than expected, and those delays are hard. For some care, particularly emergency care, the added strain or travel is risky. Heart attacks and strokes don't wait. According to the Pennsylvania Department of Health, Regional delivered 1,773 babies in 2023, compared to 777 at Geisinger CMC. Regional is on track to deliver 1,800 babies before the end of the year. This means that about 70% of births here in Lackawanna County occur at Regional. Of the births that took place in 2023 at Regional, 225 of the births required NICU care. There is no other level 3 NICU in Lackawanna County. The next closest level 3 NICU is a 45-minute drive from Scranton. Beside labor and delivery, other routine care will be lost as well. The Geriatric Behavioral Health Unit in the Moses Taylor building that is currently able to serve patients with physical health problems as well as their mental health care needs. This unit is already running at 85% capacity. Closing these beds would create a crisis situation for the 412 people who were admitted last year without other options. Regional's ER saw over 36,000 visits. Other local hospitals have long wait times that exceed both national and state median wait times, making it even harder to get time-sensitive care. So just to briefly, review the next slide. Lastly, regional provides roughly a third of the hospital bed capacity in Lackawanna County. If regional closes and you add up the remaining bed capacity, you do not have enough beds to meet patient demands. Demand for patient beds would exceed the capacity by 25%. This is literally not possible. We can't do it. And again, even if a service isn't lost, the increased demand at other hospitals will likely result in backlogs. And until new plans are available, some of that care might not even be covered at other hospitals depending on the patient's insurance. It's very clear that regional hospitals closure presents huge access barriers for the local community. Another thing to look at is overall cost. When comparing prices between regional hospital and other area hospitals, regional consistently offered lower costs for the same services. An X-ray will cost 4 to 5 times more at other hospitals than at regional. An MRI is nearly double at one hospital and almost 4 times more at a different hospital than it currently is at regional. FAN compared a lot of different services and found some differences that were even 7 to 9 times more than what patients are currently charged at regional. This is a really big deal for the uninsured and underinsured and would likely lead to more medical debt. Many people, including those with health insurance from their jobs, have deductibles. For those individuals and families, these higher costs come directly out of their paycheck, as they have to pay for every dollar of their care until their deductible is met. The last important thing to note is that even if you are not currently a patient at regional, you too will struggle with the fallout of regional's loss. We have seen this in other communities. It will be harder to schedule appointments. You'll wait longer to get routine care. And in emergencies or when you need hospital-based care, you will be in a system that already has enormous strain. Because of all this, we urge state lawmakers to work with the local community to find a way to keep regional open. It is a vital part of our hospital safety net, and all of us will struggle if regional closes. Thank you for your time.
And thank you, Emma. When you highlight the time and the wait and emergency room access, I'm looking over here at our Commissioner Chris Shermack, who's here tonight. Thank you for being here, Commissioner. Commissioner also has a healthcare background. You have to correct me. How many years? Say it's longer than me. Just say you're older than me. I'm 29 years. You're 30 plus in the healthcare field, and you are. I know you work in emergency room.
Still a first responder, EMT.
EMT. So you know what the hospital, when he arrives in the hospital with a patient and the ER is on diversion, you can't go on diversion. You can't go down to Philadelphia. You can't go to Allentown. So you know what we face. If regional hospital closes, you know what we face because you know the wait time with Geisinger. And you know what happens at Lehigh Valley. So, to have people like Commissioner Shermack, myself, and my colleagues here, we are all hands on deck. We need to get to a solution here, and we have the unique background between Commissioner Shermack and I to know how important this is when it comes to emergency care. I am also very privileged to be able to work with our Senator Marty Flynn. We've been, like I said, my colleagues and I have been really talking about this for months, and it's at a crisis level now. So I'm going to introduce the Senator. We were in Harrisburg in June when CHS came up to speak to us, and they asked me to not. They asked me to, maybe keep the senator out of the meetings from now on, because he's so passionate and so angry about what is happening to our community and our hospital that I want him to talk a little bit about how we are advocating and what we've done so far about this problem and trying to get to a solution. So, Senator, do you want to come on up here?
Yeah. Thank you, Bridget, and thanks everyone for being here today. My staff gives me these talking points, these speeches, and I'm not reading them. I'm not reading them, Bridget.
I know, it's okay.
This hits home. My daughter was born at CHS. I've been going to these hospitals my entire life. This is no joke. We've been sounding the alarm for over a year. We've been trying to find someone to buy this place. Bridget's all things healthcare, so I always defer to her. She's a nurse, she knows what she's talking about. I don't was boxing, she'd listen to me, I know that. So, we've been trying for years, nothing has happened. CHS made us shut our mouths, we couldn't usher anyone else into this. Okay, now we have to because they failed at putting their deal together. Okay, when we think about this, I think about the Chief Executive Officer, Tim Hingen. I think about Kevin J. Hammonds, the President and Chief Financial Officer. The Executive VP of Operations, Kevin Stockton. I think about him. Dr. Lynn T. Simone, MD, President of Healthcare, and she's the CMO. President of Region 4 Operations. I think about Chad Campbell. I think about Jason K. Johnson, the Senior Vice President and Chief Accounting Officer. These people need to step up and stop hiding and taking their private planes to the airport in Harrisburg, showing up in their suit, coming and telling us they have a problem and their company does $13 billion a year and they can't make a profit. Okay? When they take their asset that they bought and depreciated over 10 years, turned it into shit and did nothing to fix it. The names I just said, they're the people that did it. Those people. And they need to atone for that and find us and help us find a buyer. Not squeeze us. Not squeeze us. Oh, we're gonna close. We need this million, we need this many to stay open for the month. No, they need to step up and help us find a suitable buyer and a suitable healthcare system that cares about the people of Northeast Pennsylvania. Because this isn't a question of if. It's not a question of if. People will die. People will die. Children, elderly will die if this doesn't happen. That's a fact. And these people can run back to Tennessee, but we know who they are. I just told you who they are. There they are. Those are the people. They are responsible for this. Okay? They have to help us leverage and get that healthcare system in the hands of someone that is responsible, that wants to invest in our community. Because that's what matters. That's what matters. Investing in our community. Okay? Not running back to Tennessee, not spending a dime here, and just appreciating your asset and moving it around somewhere else and then buying another hospital system. Or I think they sold a hospital system last week, didn't they, somewhere? So this is the game, folks. We know what it is. The jobs, this is a tenement of our living in Pennsylvania, in Northeast Pennsylvania. This isn't only a Scranton problem. This is Lackawanna, Luzerne, Monroe County. It branches off into everywhere. We need to get a responsible buyer to come in here and take this healthcare system over. And they should get a good deal. They should get a good deal. Now let's not forget about the foundations and the nonprofits that profited, because they got a good price for this. They have to also step up with us and help. They have to help us. The Moses Taylor Foundation, the local nonprofits, when it comes to the table here. The last buyer couldn't get it done, couldn't get the money. The bonds were too junky. They couldn't get. But we need a responsible investor to come in and help our healthcare system and give back and give back. It's not for profit. It's for life.
You know, honestly, I know that this has been a really stressful time, and I know that as healthcare professionals, you can go and you can take your resumes and you can go elsewhere. But I have a feeling a lot of you are still here working at Regional and Moses Taylor campus because you believe in the hospital, you have history with the hospital, you may have family members that worked there before you. I'm seeing some people that just walked in. I see my friend Dr. Donald Create, who worked there as an orderly, maybe? Were you an orderly at the hospital? So I mean, there's a lot of history in our hospitals. A lot of the physicians I know that work in that hospital worked there as in dietary, as orderlies, as their parents worked there. Their dad was a doc, their mom was a nurse, their dad worked there, their mother, their sister, their brother, they were born there. They have a real strong connection. We have a unique village here in Scranton. I say that all the time because growing up here and having that connection to healthcare, I know a lot of people that could have gone and could have left if they don't. They stay here with us and they really want to be able to take care of the patients that we see there because it's generational. It's no doubt that we in Scranton have a high elderly population. people that have generationally lived here and grown up here, but they deserve better from us to make sure that they have that health care that they're going to need as they age. So that's really important that we come to a solution tonight, and we come to a solution to keep these doors open for the services that are provided. There's unique services provided there. And I think that that's something that people have to remember. And I am not an alarmist, but as Senator Flynn said, people will lose their lives. People will die. And we cannot let that happen. And we have an opportunity tonight to make sure we put that pressure on and we make sure people understand that. I have great faith that we will come to a solution. We have great partnership in the governor's office, and it is at their top priority, and I do believe that. So that being said, I want to open it up to questions and answers. Excuse me, the senator's interrupting me.
Let me say one thing, I forgot to say. When CHS came in 11 years ago, they said they were going to invest millions of dollars into that hospital. They didn't invest any. The only thing they ever did was they fixed the one roof. It was flooded. They got insurance money. There was a room flooded, cardiac care, and they fixed that. They didn't do anything to any of those buildings. They didn't update anything. They ran it into the ground. And if you look at their stock was up to like $20 a share in the last 5 years. It's at $3.40 today. There's a reason for this.
Yeah, and it's true. I mean, if you don't invest in this facility, I'm speaking to a room full of people that understand that. You don't invest in a facility, our specialists, our surgeons, our docs, our nurses, they don't have the resources they need to take care of their patients, and then they have to go elsewhere because we don't have a system that was backing them. And I want to bring them back. I want to bring our specialists back. I want to bring them back to work in our community. And I think we can do that, and I have great hope we can. So I'm so grateful that you're all here tonight. I'm grateful that people here, we're all open to any kind of conversation or questions you have. I do have a few people that I'm going to call on tonight, but please, this is a town hall, and please voice your opinions, voice your questions, and your concerns, because that's what we're here for tonight. Kathy Owen, Kathy, there you are. Kathy is a physical therapist and a physical therapist at Regional Moses Taylor Hospital, and maybe you can share a little bit of what, we hear what we hear, and we know what we know from our meetings that we have, but you're on the ground working there, so just tell us a little bit about what you've heard.
We've heard a lot of rumors over the last year. We were very hopeful that Woodbridge would buy us and invest in our hospital and our services. Very disappointed, and we were very surprised when letters came out saying that, the hospital will operate as normal until the end of the year. And then there was nothing after that. So we're really looking for someone to buy us. I do have a question though. We would like to know if anyone is showing interest in buying hospitals, and do you think we will have a buyer?
I do. I think that I know that the governor's office, and along with all of us, have engaged with some good community health systems in the Commonwealth and around the Commonwealth. I mean, we've heard rumors, and we've had discussions, healthy discussions with other healthcare systems. So I do know that we have. I have great faith, and I have great hope that there will be a system that comes to take over for CHS and run regional campus on Jefferson Avenue there. So I do know. I mean, you want to know who they are and names? Yes. I mean, we've spoken to a lot of local systems, but other systems in the Commonwealth that see the access here and the community need here. So I do think that we have hope that there is someone that is going to come on in and take over. So I know that letter said the end of the year, and we would like to have an answer. We are pushing for an answer by the end of this next week. We really want to know who it is, how we can keep these doors open, and who's going to come in and deliver care here.
We do stand, and you guys might have been working on this for 6 months or so. We're about 6 days into this, but we've already reached out to Senator Fetterman's office, as well as Senator-elect Dave McCormick's office. And if it is a local healthcare provider coming in, there will require some FTC and Department of Justice waivers, and we stand ready on behalf of the federal government to step in to make sure that there's no time to waste in the transition process. Obviously, I think it's paramount that we need to maintain some sort of health services in Lackawanna County, and also from a bandwidth perspective, CMC just isn't going to be able to withstand the influx of caseloads and patients. So we need to be able to hit the ground running on day one in the event that Commonwealth decides to rip the rug out from underneath us here. And that's something that I always obviously have some grave concerns about here, is making sure that there is some kind of bridge or pathway to care and an intermediary in the event that CHS does decide to do something drastic. So that's what I can opine and what we've been able to fact find on our own research.
Linda, is Linda Schmidt here? Lori. Now, so I can clarify before you speak, in the Woodbridge sale, the sale was all three campuses. It was CHS, Wilkes-Barre, and the Scranton campus. As for now, according to CHS, the Wilkes-Barre campus is going to continue to be operated by CHS. They are looking to sell the Scranton campus. So they're all coming your way if we don't have a Scranton campus. So go ahead.
Yes, I'm Laura Schmidt. I've been working at Wilkes-Barre General Hospital for more than half my life. I've been there 37 years, 27 as a registered nurse, and I currently work in the cardiac rehabilitation department. And first of all, as for CHS saying that we are desirable and they'd like to keep us, I don't believe a word they say. They promised us things many years ago, many promises. We were going to be wonderful. They built our beautiful ivory tower, our critical care unit. One whole floor is closed. They built an emergency room, which is beautiful, but it's understaffed. People are waiting in the emergency room for 10, 12, 14 hours. So if these hospitals close, my question to you is, what's the plan for the other area hospitals to take this influx of patients? Now, if cardiac rehabilitation goes, our department don't have enough machines or hours in the day to rehabilitate our cardiac patients who really prosper from that program. Our emergency room is going to be worse than it is now, with people waiting in excess of 17, 20 hours waiting for that. We've also had, as horrible as it sounds, we've had several OB emergencies come into our hospital, which our nurses were given an 8-hour class on how to handle an obstetrics emergency because they closed our OB department. Most of these, sadly, OB emergencies have had a very negative outcome. So what is the plan for Wilkes-Barre General, since we're so desirable to stay open, to pick up these extra patients?
Certainly, even if we were to have to transfer these patients, everybody in this room knows that the time is of the essence. You can have an ambulance there, you can have a place for these patients to go, but a lot of them are in crisis, especially people in labor and delivery, and they don't have the time to be transferred out. We have services here in Scranton, on the Scranton campus, I know that do not exist in other campuses, like our hyperbaric chamber. We have cardio pulmonary rehabilitation, the ECT procedures. I mean, there are certain specific procedures that are done here that if we do close, we can't turf them up to Geisinger or down to Wilkes-Barre. We have to send them elsewhere, outside within a radius of 80 to 100 miles away. So good question. Do I have an answer for you right now? No, I do not have an answer, because other hospital systems have reached out to me and said, look, if you do get to a point where you close, like the wonderful people up at Wayne Memorial and Guthrie, they have asked, if you need help, we can help you house, transfer patients, but that's not the solution for long-term sustainable solution for what happens on that campus there. So good question. That's the crisis. That's where we get to the point where we say, are we going to have people lose their lives because we couldn't come up with a solution? And that is not an option, as far as the people here at the table with me.
Yeah, we push the chips in. They're in. We got to find a buyer. That closes, people are going to die. The healthcare system's already overstretched. Look at Geisinger. You go up the emergency room up there, you're waiting for 4 or 5 hours. It happens every night. Yeah. That's what we're saying. That's what we're saying, guys. It's on. Yeah, and you don't even get seen. Yeah.
Warren Faust, Warren.
Warren Faust, I'm president of the Northeast Pennsylvania Building Construction Trade Council. I also serve on the Wilkes-Barre Area School Board, Wilkes-Barre Area VOTEC Board, which I'm running out to a meeting tonight. And these closures have so many impacts. Profound. Look at the nursing program at Wilkes-Barre Area VOTEC. The graduates come and they apply for positions at these hospitals. We have to keep them open. First and foremost, to all the elected officials and the soon-to-be elected officials, I know each and every one of you. I've been proud to work on various problems throughout Northeast Pennsylvania with you, and I can't thank you on behalf of everybody for what you are doing here tonight and pushing this in. As the senator just said, the chips are in. And you look at different factors, but one would be, what would happen if Scranton was, let's say, a loss of tax revenue if a nonprofit organization takes over? I mean, that, everything has impact.
Warren,
on the community.
40% of this city, 40% of it is already owned by nonprofits. Okay? If anything, a hospital should be nonprofit. I have no problem with that. I have no problem with the hospital being a nonprofit. Because it shouldn't be a for-profit business. It does, as we can see, it doesn't add up, does it?
No, didn't work out, did it?
No, it's not working out. $3.40 a share right now.
Well,
Right? If I mention their names, you guys can put that.
Again, thank you for being so proactive, and as you said, I mean, we all have so much to lose by losing one of these 3 hospitals, let alone the other 2. I mean, if the first one goes, what happens to the second and the third? We've all been down this road. So thank you.
I just want to clarify a couple things that we've already talked about here today. And one is, this system, and while the Senator has said it, and we have worked on this for months already, the state does not run hospital systems. This was a venture capitalist group that got together and thought it was a great idea to start running hospitals. And in the beginning, it worked well, and they went around the country and they bought out many hospitals. And in 11 years later, after they purchased our hospitals here in Scranton and Wilkes-Barre, they ran into a lot of problems. And their stock was down, like the Senator said, to $3 and somewhere around 60 cents a share.
40.
$3.40. I didn't check that today, thank you. But this was done to make money. Venture capitalists to make money on the backs of the people in Northeast Pennsylvania without putting, we talked about depreciation of their assets up here, but what they failed to do was make the promises that they delivered to us saying they were going to invest. After they purchased, they did darn little investments into this community system. And now we're faced with this company at the end of this year looking to raise $1 billion by the sales of hospitals. They sold 2 other single hospitals this year, or in their process. And this, to give you guys a scope of what they're doing to us and what they've done to us, was the hospitals that were being sold were something like $240 million for one, and $265 million for a single hospital. This was 3 hospitals in Northeast Pennsylvania, right here in Luzerne and Lackawanna County, that they were trying to unload for $120 million for 3 hospital systems. Because they failed to put money in, and they fooled around with people's health. And the chips are all in, because this is serious when we say we're in a healthcare crisis. But on the positive note, our first speaker talked about it, and Northeast Pennsylvania, as a former banker, one of the first things that we bragged about in Northeast Pennsylvania was the people that were born and raised here and that live here, and the work ethic. And the plus for a buyer to come in to this area, because we have to highlight something here, is that our people work damn hard in Northeast Pennsylvania, and they'll put 110% of the work day in. You should clap, because you're clapping for yourself, folks. Because we appreciate what you do every day in Northeastern Pennsylvania to make our area what it is. But we have to say something positive here today, that this company has bastardized our area, took the profits, and somebody someday might go to jail over this. Because they're putting people's lives The last time we did speak, they did tell us they had Woodbridge as a buyer, and because they were a publicly traded company, they could not talk. And they didn't really hype me. And I know the senator got quite passionate, but I said, oh, they can't really talk to us. Marty said, I don't care, I want to hear it. And he was great. But now, the deal's off the table. So I'm sending a message to their management team that Marty named. It's open to negotiations. Well, we can help you with the state. We mentioned that months ago, the governor's office has weighed in. Every one of these legislative members have weighed in. We've reached out in the past to Matt Cartwright, Fetterman's office, and of course, Senator Casey. And now we're glad to have Congressman-elect Rosenhein here to carry it toward John. But we're open, and you're hiding. You haven't come to the front again when this deal failed. We haven't heard from them. And that's alarming, because the deal was off. They could talk, and they could ask for help at this point, and they haven't. That's what's really upsetting to me.
As the mayor of the city of Wilkes-Barre, what's happening in Wilkes-Barre General Hospital in the city of Wilkes-Barre is just terrible. The loss of services, okay, I've seen it myself as a patient. I've seen what happens, and I'll tell you what, it just makes me mad. Makes me damn mad. And the problem is, when Woodbridge came to my office, and they said, Mayor, look, we want to buy Wilkes-Barre General along with all the subsidiaries in the city of Wilkes-Barre and also Scranton. I said, okay, tell me about what you want to do. Well, we need your help. We want to secure a $180 million bond. Okay, what's going to happen? Well, we're a nonprofit. And I said, well, you know, you're a nonprofit. We're going to lose about $775,000 in property taxes. Yeah. We're going to lose about $180,000 in mercantile taxes. Yeah. And you know what? It's a big lump of money to swallow, but you know what I said? If you can bring back the services that General Hospital lost, okay, the OBGYN and the other services, the trauma unit, I'll swallow that $1 million in my budget. If you can make sure that you hire back the services that were taken away from Wilkes-Barre General Hospital and the people that work here today and the people that are living in the city of Wilkes-Barre. You know what he said to me? He said, Mayor, we're going to do that. He said, we're going to hire more people. We're going to work to bring back the services, the doctors, and the services that were taken away by Wilkes-Barre Commonwealth Health, I'll call it, okay? And I said, I'm behind you. I went before Councilman Brooks and the other city council members, and I said, we have to give approval to float this $180 million bond. And I said it because I don't want to lose, nor do you, lose any more employees at Wilkes-Barre General Hospital, or lose any more services. So what happened, you all know what happened, bond fell through. Now we're back to square one. Ladies and gentlemen, the nonprofit takes over this system. I'm okay, once again, to give up that $1 million as long as I know they're going to bring back the services that we need in the city of Wilkes-Barre, right, Linda? We're going to bring back the services that the people, the 55,000 people in the city of Wilkes-Barre need, because that is our largest hospital, one of the largest employers in the city of Wilkes-Barre. You know that or not? Okay, Wilkes-Barre General, I believe it's bigger than both hospitals in Scranton. And the thing is, I nor anyone else in the city of Wilkes-Barre can afford to lose any more services. Okay, the gloves are off. Marty, I stand next to you. Okay, with the gloves off, we're going to fight for this, but we're a team. And Bridget, I thank you for inviting me today. Folks, I'm telling you something, as Mayor of Wilkes-Barre, we're going to fight for this just like everybody else is. And we're going to get this done. So let's work together.
I want to invite Representative Kyle Mullins up, who wants to say a few words as well tonight.
Thank you so much, Bridget. It's my colleagues and to all of you who, this is clearly personal for everyone in this room. It is so personal, you can feel it. So I first want to say thank you for playing such an active role, not only in the betterment and the health and wellness of our community, for making a nervous, expectant father a father of a healthy baby years ago, Moses Taylor, for caring for countless members of my family, and I know so many families in this room. But to be very clear, our work, and I know my colleagues my fellow state legislators will agree with me, that our work does not end with trying to find a suitable and responsible operator, right? That's the near-term fight here. But the long-term fight is to make sure that we restrict and prevent private equity from entering our healthcare system. We've seen how this goes. And God forbid, any community, set of patients, staffs, should have to deal with something like this in the future. So I want you to know, our fight isn't over after this town hall. Our fight isn't over after, God willing, a good buyer comes in. Our fight will continue to make sure that we return stability and responsibility to our healthcare delivery system. You can care about profits, or you can care about patients. You can't do both.
And there are lots of moving pieces. Like you said, there's an immediate fix and then the long-term fix. That's why I'm grateful to the team I get to work with and how we all work together on these solutions. I want to invite Representative Eddie Day Pashinski from Wilkes-Barre to say a few words as well.
What is this about? Money or life and death? I think the answer is pretty clear. It's about money. Don't tell me we have an emergency room and it's going to take 8 to 10 hours before you get there, before they take care of you. In my opinion, they should be held accountable. In my opinion, they should be held accountable. Your responsibility was to take over that hospital system and provide the care that your oath tells you to do. All of you that went to school and studied, the doctors, the nurses, you are very, very special. You have not only the ability, but the heart and soul to be able to take care of folks in pain and suffering. That is an incredible thing that you do. Are you asking for something that's not possible? We got 500,000 people between Lackawanna and Wilkes-Barre. We can't have a hospital system that provides quality care on time, gets the job done, and still has enough dollars to make a profit? Come on. Come on. In my opinion, they should be held liable. You can quote me on that. You can quote me on that. Cut the baloney. This is about people's lives. You can still make money. Oh, not enough? Sorry. What is this? What is the point of having a healthcare system if you have to wait 8 hours or 10 hours to get an emergency room? What is the point when, oh, you have a pregnancy? And you can't do it here. You got to travel 30 miles, 20 miles, 50 miles. Ladies and gentlemen, I myself, along with my colleagues, I think it's pretty obvious. They care tremendously. We care tremendously. Let's think outside the box. Maybe we have to run our own healthcare system. Maybe we work with the governor of the state to make sure we get the money and bring all the quality that we already have right here. The gifts that you provide for your patients. Like I said, not everybody can be a doctor. Not everybody can be a nurse. And all that it takes to take care of our families, our loved ones, our children. Are we together on this? Are we together on this? Are we together on this? You know why we're together. We're going to fight these guys until we make sure we do the right thing. Thank you.
Representative Donahue, do you want to say a few words? Representative Donahue also splits the city of Scranton with me, so thank you.
Over the last year and a half, we wouldn't be able to be even where we are today without Bridget's leadership. Her knowledge of the healthcare system has been indispensable. So thank you. I just want to go back to Woodbridge a little bit, just because I don't believe, I was critical of Woodbridge also buying the system, because if you look at Woodbridge's history, they were a for-profit private equity firm that failed multiple times in multiple states to buy healthcare hospital systems. Then they spun off into this nonprofit. And I just didn't believe that they were in it for in our community's best interest. So I believe it was Einstein that said, you know, great crisis creates great opportunity. And I believe that is where we are now. We have a lot of good people in the governor's office, my colleagues to my right that are working diligently to find a solution. But I think when you look at where the value lies in our hospital system, it's all you. It's the human capital. That's the only value that this system has because CHS over and over again has failed to make proper investments. And I don't believe that this is necessarily unique to our area either. You see it throughout the state of Pennsylvania, whether it's Crozier in Delaware County, Stewart out west. There's a couple things that are different, but there's a lot of similarities to it. And just in terms of what the state could do, with Stewart out west, they got their foundations together, the state contributed, and the community came together to save the system until a buyer comes forward. Down in Delaware County, the Attorney General actually filed for a receivership of the hospital, and they're working with Penn Medicine to, you know, keep operations going for the time being. So there are a lot of options. We're working on them every day. I've gotten a lot brighter over the last year talking about this. I have two daughters that were both born in Moses Taylor, and I could tell the difference in the lack of investment in those hospitals from when my first daughter was born in April of 2021 to when my second daughter was born in October of 22. Not the care, but the actual cleanliness of some of the buildings, especially the emergency room at Moses Taylor. But I just want to assure you that we are working diligently to come up with a solution, and we will. Because, like Senator Flynn said, people will die if this hospital closes, and we will not let that happen. So, in terms of the workforce, we need you to trust us for the time being and stay with us, because you are the only value left in those buildings. And we're going to keep you informed on any developments we have, but we need you to hang in there with us, because without you, there is no hospital system.
I think, Emma, you want to say a few things? Go ahead.
For anyone who missed me talking in the beginning, I'm Emma, I'm from the ICU. And I just want to assure everybody, especially from being down on the ground in the hospital, going through negotiations, I mean, I work with some of the most hardworking people. I work with people who their parents used to work at Regional and now they're working at Regional. I work with people who work up at Moses and their sons work down at Regional Hospital. I work with people who just did their 1,000th TAVR at Regional Hospital of Scranton. We have an amazing cardiac unit. We have amazing NICU nurses. Every single nurse and every single ancillary staff in our building is Scranton. Everybody needs to realize that these are the people that build for the community. Without this hospital, without the community, Scranton has nothing. You are Scranton. Right. I'm not even from Scranton, and I know that. I'm from Halstead, Pennsylvania, and even my neighbors come down here for the care that they deserve because they don't have it in their communities. This is what is holding Scranton together, and we cannot let that go. CHS has already ruined it far too much, and I mean, the people that I work with, we're not ready to give it up. I mean, we're going tooth and nail fighting for this community because we know what everybody deserves and we need to take care of these families.
So if we were just listening to the nurses, we would figure this out. Like, get out of our way, we'll figure this out, right? So thank you for saying those words. It's impactful.
Hi, my name is Keisha Williams. I'm with SEIU Healthcare Pennsylvania. I'm an advocate and a community member. I just want to thank all of my state reps for being here. I want to thank SEIU Healthcare Pennsylvania. And I have a question. How do we hold these CHSs accountable? Make sure the next CHS doesn't come in and do the same thing to our communities. Suck up all of our money. Suck up all of everything we put into this community and drain us dry and leave us like this.
Mullins, Representative Mullins about the future of how we don't let this happen again. Yeah, we're on the same page. We don't want this to happen again. We do not want for-profits to come into our community-based hospitals and do what they've done, get to the situation we're at now. So it's part on our responsibility in the state, legislation, laws to pass and legislation to put forward. And we have great partnership with our state legislators and our senator. And I know that we have legislation partnership in the federal government as well, right, Rob? Where's Rob down there?
Sure.
Yeah. So,
And you do.
yes, we do. I think you have a good team here that knows what happened, and we don't want that to happen again. So thank you for asking that question, and yes, I think we have a pathway forward to make sure that we keep our community-based hospitals and our patients safe.
I just want to mention too that in this past legislative session over the summer, the State House passed legislation that gave the State Attorney General more oversight of hospital sales and transactions. It passed through the State House, it went nowhere in the State Senate, but I'm looking forward to having that reintroduced again and getting that across the finish line. We've also been discussing, when we talk about a lack of investment into the hospital, physical plant of the hospital. We've also been talking about creating a grant program to reinvest in our hospitals, to make it not only on the backs of the nonprofits, because it serves all of our communities and it is an issue statewide. So we've also been talking about that as well, to make the investments necessary to get world-class care that is possible. We just need to make those investments.
Yeah, time for some transparency.
Hi everyone, my name is Wendy and I work in Mom Baby at Moses Taylor Hospital. I absolutely love my job. I've been there the past 10 years and I love my coworkers, my patients. Prior to working at Moses years ago, I worked at Corning Glass, and they once had an issue where their company was closing, and so they turned it into what's called ESOP, Employee Stock Ownership Plan, where the employees own the company or the stockholders. And it would be, other hospitals have this organization and it would be run like a nonprofit. And I'm just wondering if anyone would be interested or available to help us explore that.
First of all, it's an awesome idea.
That's a great idea.
Do you want to do it? Do you want to run it? That is a really good, honestly, because it's putting back into the hospital, certainly the people that work for the hospital and take care of the patients. So, no, I don't know if that's something that is happening now locally in our, conversations that the governor's office is having with the healthcare providers that want to come in here and take over. But yes, I do know that's something that we should definitely think about, talk about more, and it makes sense. So thank you for bringing that up. And I do want to say before, the foundations, our local foundations are actively participating in all of these conversations with us. They see the needs and they are actually very active in the conversations of what they can do to help keep these doors open as well. So we're grateful for the foundations that are here local in Luzerne and Lackawanna County.
Good evening. My name is Virgil Argenta. Not looking to get into my personal life, but I had open heart surgery, triple bypass at Regional. Second day into my recovery, I coded. You're all familiar with what that is. And if it wasn't for the staff at Regional Hospital, I wouldn't be here today. I was in critical care, intensive care for 3 weeks. They fought day and night to make sure that I'm here today doing what I'm doing. And also, I could have left here. I could have went out of town and had my procedure done. I stayed here, and I had local people, my friends and neighbors took care of me. They brought me back to life. And then the cardiac rehab, I wish I could go to that every day. The first day I went there, I was like, there's no way I'm coming here. I looked at the treadmills, I said, I'm not doing it. My wife said, give it a shot. I came back, and like I said, I dropped 60 pounds. I go to the gym every day. I wish I could do it every day I'm back. I just want to tell you thanks, and we need to keep Regional in our neighborhood. Thank you so much.
My name is Colin Mazios. I work at Regional Hospital in Moses Taylor. I'm a switchboard operator. Jim is a switchboard operator. We love our doctors. We love our nurses. They need us. They call us for doctors. They call us for numbers. They call us codes. If they don't call a code to us, we don't get the people over the PA. We don't get them to where they need to go. We have transporters. Do you know that transporters have to do CPR on a person in a code blue so the doctors can push the medicines? These transporters and our switchboard doesn't get paid anywhere near these other people, all right? We do just as good a job and get, people come in and they see me at my desk. I'm sitting there, the phone's not ringing. She don't do anything. But if that person had a code blue, I'm the one who's gonna get the doctors, get the nurses, call over to the other hospital, have doctors transferred over by golf cart.
Yeah.
Things have changed terribly, and I just want to say that the cafeteria used to be open at least for second shift.
Yeah.
Now they close at 2:30.
Yeah.
Only people that can eat is first shift. If people don't bring their food, if they don't order DoorDash, they don't eat. Third shift, I carry my own ice.
Yeah. And when I say the staff, I should be more inclusive, because it's not just the doctors and the nurses. There are the names that we say when we say hospitals. It's everybody. It's everybody from transport to ancillary to dietary to health.
My name is Stan Homer-Polsky. I'm a nurse at Wilkes-Barre General Hospitals, and I'm there since 1988. Thank you for all our legislators being here. We see them at our union event. I was a former executive board member of our PASNAP union, so I've been around a little while. And I was up here in 2011 for the sale of this hospital to CHS with a group of nurses pushing back in a room similar to this at Mercy Hospital, when all the white coat administrators and all the big suits from CHS came up to tell us what a wonderful thing this was going to be. We had already experienced CHS firsthand for about 2 or 3 years in our facilities, so we let it be known in a public setting like this that be careful what you wish for, because this is coming your way, and here we are a decade later, and now we see potential closures and minimal resources to take care of our community. So I've been through all the fights, I've seen all the changes, we've seen the destruction and the pillaging of our community. But my question is, I know from just being around a little while that in the big city markets, such as Philadelphia, Pittsburgh, I understand they have safety net hospitals where their funding might be a little bit of a different scenario than what small community hospitals get. I think Temple and maybe a UPMC hospital in Pittsburgh are considered safety net hospitals. So is that something that can be brought to this region in this type of situation to prop up our system? And I'm not sure exactly how their funding and the ability of that works, but
Federal
reimbursement.
Federal reimbursement rate.
That is a parallel problem that I know the Congressman-elect and our team will work on. Reimbursement rates, and why it's different in some regions of this Commonwealth versus others. We take care of, and I don't know who it was, Emma, we take care of patients from all over the place, not just patients in Lackawanna County. We take care of patients from Pike, Wayne, Susquehanna, and those reimbursement rates are different, and it makes the difference to the profit in the hospital. And let's be honest, we need to make some sort of profit so we can pay our employees and take care of our infrastructure, but that is a parallel problem that we are currently working on. And 6 days, how many days do you have to hit the ground here? But that is something I believe that the Congressman-elect will continue to work with us on that issue, because it makes a difference.
so is it something that is actually feasible initially to have
Very
a
low.
safety net hospital in this region?
So
Since they
that's-
haven't been bigger cities.
That's why they're essentially saying they're gonna keep Wilkes-Barre and get rid of Scranton, because the reimbursement rates are higher in Wilkes-Barre than they are in Scranton. Even though it's, 15 miles down the road,
And
they are getting.
and that's why the wages are lower
Yes, and
in
we've
this
been working
area
on this for a
versus
long
the
time.
Valley and
Yes.
so.
Remember their names, folks.
We will come to a solution. Go ahead.
Okay. We all are here because we know this hospital cannot close. We do not want this hospital closed. People will die. Our community's in trouble. So it is my understanding, and I'm asking you to correct me if I'm right or wrong, that CHS has to petition the state for closure. And the state has to give answers yes or no. Is that true?
They have to provide 60 day notice.
So they don't have to ask for permission?
They have to provide 90-day notice. And the problem with the 90-day notice is everyone in this room worries about what they're gonna do to make a living and provide for their family, correct? So you start going and looking for different positions, and then it essentially just
Kills the sale.
Because you're the only, like I said before, you're the
You're
only
the only
value in
asset.
this place.
So that hurts, that one hurt. So I'm not gonna lie, so I guess what we want to know as a community while we're here Is there a hospital that is going to buy us? Is there somebody pounding on the door that wants us? Yes or no? Like, give us
There
the.
is a solution, and we do have healthy conversations with health systems that are willing to come into Lackawanna County to regional and be reasonable delivers of care for our community. So yes, and I say that with great confidence and faith that this will happen. Yes, we have. Yes.
The question is, how soon are we talking?
I have been given a soft reassurance date by the end of the year that we will have an answer. And this place, we are not going to close the doors of regional.
And a question that's being asked, is there a possibility that the state takes us over?
Yes. I mean, there's the possibility that it could be put into receivership, but that becomes then a court proceeding where, you know, a lot of lawyers. Yes, so that's what's currently going on down in Delaware County with Brozier. The state attorney general filed a receivership, and Penn Medicine came in as a partner to continue to help to deliver care.
I'm a new EDRN, so like I can only hope to have a longevity here as like say Stan and Lori over here that everyone here has been talking about. Like I wasn't born and raised in this area either, but like Emma said, like I can see the family here and I love working at General. But some of my question is, we used to be a 500 bed hospital. We've been whittled down to 161 inpatient beds from the original units, and those are only like med-surg, tele, and 17 ICU beds because they spent so much money on this ICU that we can't even use. So feeding off of what they were asking, as far as like staff is concerned, like what's the guarantee in our longevity, like what's gonna happen for General, because even now we take patients from Regional, Moses Taylor as our sister hospitals, which is great, we support each other. But I just got a patient the other day from Lehigh Valley hospitals. We're getting patients from even farther out in the ER, from ER to ER, or even from their inpatient to our ER, holding up beds, and then we're holding patients 12 plus hours. I held 2 ICU patients the other day for 24 hours in the ER. So how does all of this affect us at General and our longevity and just the support that we don't have already, but that we're still trying to give our sister hospitals?
Yeah, so good question, and no one should stay in the ER for 24 hours. The emergency room is not a place for an ICU patient and a patient in acute psychosis. They should not be in an emergency room setting. We have to do better. So to answer your question about the longevity of CHS Wilkes-Barre, because you are a more profitable hospital than what we have in Scranton, and obviously you're taking patients from Lehigh Valley, we're turfing patients. Lehigh Valley, Dixon City cannot absorb an emergency room setting like they have opened their doors as a hospital. I call it more of sometimes a triage center. They stabilize the patient and turf them down to Geisinger, Mulberry Street, or down to you because they don't have the rooms. And it's a problem throughout the Commonwealth, the wait time in an emergency room, but it's staffing, right? Because you can have the patients there, but you need the staff to take care of them. So this is a universal issue. Staffing, recruitment, specialists to fill those beds to make sure that your hospital has a 500-bed hospital. If we don't have the specialists and we don't have the staff and the docs that are treating the patients in the OR, in the ER, to send them up to the floor, and we don't have the staff, how many times did you call the floor to give report from the ER and they say, we don't have a nurse up here. You gotta hold them downstairs. But then you hold them downstairs in the ER, and then Chris Shermack shows up with the patient in the emergency room, in the ambulance. He's got nowhere to go, so they're sitting in an ambulance outside, taking care of a patient in the back of an ambulance truck. This is not okay, and this is all of what you're telling me is all of the questions and all of the answers we are demanding from our administration. We cannot let this fail, and we cannot let our patients have to do what you're talking about, the stories, and that's one of many stories that you're talking about, right? So listen, you were an exhibit A of the generations. You know, your generation number 3, that's why this place is really important to save, because we are talking about taking care of our family and our friends. So yeah, I cannot answer what's the longevity at CHS Wilkes-Barre. I can't tell you definitively. You will be open for this many more years and everything's fine, because it's very fluid what's happening. But I will tell you, this is top priority of our administration, and we are not going to stop. These people at the table here with me, we will not stop until we get the solution that we are asking for, and that is open our doors, help us recruit, help us get our specialists back here, and help us increase staffing. Those are the main goals that we have tonight.
Bolus from Scranton. I come from a medical background here in the city. Brother was a plastic surgeon here. My mother was an RN. Came from the state hospital, the west side, when it was the state hospital, to Mercy, where she was the charge nurse. So I'm EMT trained. I've been credited with saving over 15 lives in truck and car accidents. And what we're hearing here tonight, and Eddie brought it up, we have to think outside the box. We've listened to a whole bunch of suggestions and ideas, but what we're failing to see, right here in the city of Scranton, we have a medical college. Why aren't we supporting the medical college, funding it? Look at the millions sitting at this table. Funding the medical college to take over and operate our hospitals. There is no question of gouging. Nobody's going to be flying jet airplanes or going anywhere else. We train our physicians, and then we send them somewhere else. Why not keep them right there?
They are part of the conversation. That's Geisinger.
I understand. It doesn't make a difference if it's Geisinger or whoever. You guys are the legislators. It's the medical college that trains them. I'm a patient at Geisinger. I've been a patient at Lehigh Valley. I've been around the whole damn world. But we have a medical college where we're training our people. Whether it's Geisinger, whether it was Lehigh Valley or Mercy or whatever we want to call it. The problem is, we're letting them leave our area. You have the wherewithal, above all of us, right here and now, to keep our doctors and our physicians in this area. You have the wherewithal to fund
You have to have a hospital to
medical
recruit
college.
them to work it. It's very good. Listen, all these guys at Geisinger, these students would love to stay here in this community. Abigail Geisinger has an unbelievable scholarship program that recruits and retains those students to stay here. I can't ask a urologist, an orthopedic surgeon, a guy that's finishing his residency, come on over here to regional to work when we don't have an MRI machine. I don't have a CT machine. Well, how am I supposed to?
Updated, not a question. Modernization, not a question on funding.
Funding.
So we have the wherewithal, thinking outside the box, to keep our physicians, our neurosurgeons, and other surgeons here, because you guys are the weight to keep us all alive here.
On the same page. You're on the same page. You're
Because
on the
this
same
leads.
page. Yes.
So let's do what we need for the people, keep our physicians here, take care of the medical
We are on
college.
it.
go
And we
in
have
the
to
same
encourage
direction.
our community to remember, when places like Geisinger want to expand, we have to be partners with them. Keep in mind, we have a hospital here that's very overfilled, and they need space to expand. So we have to be partners here in our community when they want to expand, when we want to give funding to, we are all on the same page, and I would love to keep that is a marvelous.
Why are we broke? All this money, why are we broke?
Pardon?
They were a for-profit, listen, Mr. Bolus, they were a for-profit system for over the last decade. No, the Commonwealth of Pennsylvania or the federal government was not going to put money into a for-profit entity. That's not how this works.
Not an entity that's acting in the capacity. I mean, if you want to fund the investments abatement for the replacement system to come in, that's a conversation I would love to have, but I'm not sure CHS is acting like a viable recipient of federal funds.
That's correct. But we are on the same page, on the same team. You have a willing cast of legislators here, both at the federal and state level, looking to find a responsible buyer and chase and secure and allocate, appropriate whatever funding we possibly can to keep these doors open.
Why would you fund here, Kyle, when you have it right here in the city?
This will be the final
People at
question.
work know that we've come here to this meeting. What do we say to them to give them hope, to boost morale when we go back? What do we say to all of our friends in this community?
That's the message for tonight.
And at work?
Yeah, that is the message for tonight. And go ahead, this is.
Hi, everyone. Drew Popish, Northeast Regional Director for the Governor's Office. I, like Marty Flynn, and I'm unscripted, but he doesn't get fired. He does it. So I could, yeah. Listen, full transparency. You guys came here for two things. You want to know, are there potential buyers? You want to know who those potential buyers are.
Yes.
I cannot bullshit you. I cannot tell you who the potential buyers are. There are several providers that have met with the governor's office. This has been a part of our administration's top issue for literally for the last 6 months, even when this whole Woodbridge thing. Listen, I can sit here and shit on CHS too. Believe me, I love it. And I could also shit on the Woodbridge deal and go into that full circle. It's pointless because I don't have time to, because we don't have time. Time is of the essence, right? We don't have time to do that. Our senior members of our administration has been working with CHS this entire time. CHS has been communicating with this administration, and we are trying to find suitable, reasonable is a better word, providers. We do have them. I can't tell you who they are. I'm sorry. We're hopefully going to have an answer extremely soon. I know that doesn't help. That you want a solid, but I need to give you hope, and I can't not say that. So when you go back and tell your coworkers, say the governor's office is absolutely on it, along with our state legislators, and we are working, and we do have actual, reputable, solid providers that are actually interested. We also spoke to, providers outside of the Commonwealth as well. And there are two in line that are really interested, and I'm hoping that we have an answer extremely soon. And also to go back to your comment before about the hospital and the states, I'm sorry, Bridget, with the 90 days and all that stuff. So yes, the state is obligated to, you can't just close an emergency room. They have to stay open. But like Kyle Donahue was saying, if they put in their 90-day notice, half the staff are gone, and then there's nothing the state can do then. Yes, receivership can happen. We don't want that. That's not ideal. You don't want it. And besides, there's no time for that. You have to go to court and everything. The AG's office is currently trying to save every other hospital too that's happening closing the state. This is happening everywhere. I get it, but it's most important to us because we live here, obviously, and it's your jobs and it's your livelihood. But without being too overly optimistic, help is on the way. We are taking care of this, but we just can't say a lot, and it doesn't help when there's rumors going everywhere and people are sharing random text messages from, the janitor they might see, and they hear a comment and all this stuff. It's blowing up. But you can't. But you get what I'm saying. So yeah, there are collaborative conversations, and they're reputable, and they actually are healthcare providers, unlike what we've had. So.
Nonprofit.
Yes. Oh, sorry, yeah. Well, listen, I'm speaking on behalf of me now as a resident in Scranton. Healthcare is not sexy and it does not make money, right? So, why a for-profit would want any entertainment in healthcare makes no sense to me because they're there for a profit. But again, I can go the route of bashing them and stuff, and I want to, and maybe we could when this is all over with. We can have drinks, but right now, I'm really but listen, right now, I have to say though, listen, and I know people don't want to hear this, but right now, CHS is working with, and I'm not going to sit here and take credit for them, but they are working with our administration right now, trying to get last day, guys. But they are working with our administration to get out, and I said I was going to say funding, but right now they are working. Because guess what? CHS, in all reality, they could have closed those doors 3 weeks ago. They really could have. December 2nd, they could have said we're done and closed it, and they didn't. Because they were working with us, and we were like, we cannot do this. They are working with us every step of the way to get out and find an actual provider.
That's because they want to make money off of what's left.
Exactly, and you're not wrong, girl. You're not wrong. But here's the thing: we have the Attorney General's office, and we have the OG, and we're going to. We are involved now, and they can't get away with certain things. They can't. They can't.
Did you say he and Marty Flynn are the favorites? Well, thank you very much for being here tonight. I appreciate it, but I do want you to know that this is a team that's working very hard, and our goal is the solution, and to keep these service lines open. So thank you to all of you, especially those that work in the hospital.
Thank you.